My name is Jeremy Kigar. I'm 37 years old from Columbus, Ohio. I'm a dietitian. I went to school for it. I worked at a hospital for 12 years. I was diagnosed April 19th, 2011 for grade 4 astrocytoma in my cerebellum. I had been complaining of headaches prior to a year to this. Went to my doctor. Doctor said it's the ultraviolet lights from working in the hospital, it's stress. I had no history of ever any problems, so there was no need for them to ever do a CAT scan or to do an MRI because I had no prior history. Went into a patient's room to do an assessment. Had a seizure. Woke up in the emergency room of the hospital I work in. Good news was I didn't have a concussion. Bad news was you have grade 4 cancer. So I was told from the doctors that day that I should pretty much go home and do anything that I wanted to do. So obviously my life changed completely at that point. And of course I was willing to at this point say I'll do anything I need to do. First thing they did obviously is start me on about 16 medications. Anti-seizure, pain medications, anti-inflammatory, antibiotics, antidepressants, pretty much the basic barrage of what they give to anyone. Started me on chemo. I had radiation. I had lost all my hair. Along this route, the medications that I was on were causing me a lot of other side effects, which has caused me in turn to have Crohn's. So now I have a lot of gastro issues due to the large amount of chemo and prescription pills that they were putting me on. So knowing some friends that I've known, that I was a lifelong friend that passed away this last year dealing with cancer for 20 years, he was a big advocate of cannabis and of marijuana and came to me and was like, you should try this. You should see if it works for you. You should see what you can do with this. So I took some Simpson Oil home with me. I took a ½ gram for probably 3 weeks. During the course of that 3 weeks, I started weaning myself off of a lot of my other pills that I was on. Just stopped taking narcotics, didn't feel the need for them.
You didn't feel like you needed them anymore?
No, I didn't feel like I needed antidepressants anymore. I didn't feel like, I felt that I was getting what I was getting, my body was getting the medicine it needed, but I was still able to function because I was at a point of so much medication, I was not me. I was a different person. My family, my friends noticed. I was pretty much just over-medicated because they don't want you to deal with the reality of what you're dealing with. And that's what's, you know, unfortunately the insurance companies and a lot of doctors are blindsided by that. So at the same time, luckily a lot of the movement had started here in the state with trying to legalize it. And at the time I started to get chemo, I had to get referred to a specialist in Ann Arbor and then had to go to the James in Ohio, which is a special cancer doctor for astrocytomas. Spoke with him, told him what was going on. First thing he said is, if this is off the record, I'll talk to you about it. I will never agree with anything. I'll never support anything for you in it on paper. He said, but I have no problem with it. I have a lot of patients that choose to do this. And so I said, well, what do I do? Where do I go? Because at this point I'm getting it illegally. And he said, well, you get treatment in Michigan. I said, yes, I do. I get it at Ann Arbor and I get it at Sparrow. He said, you need to go to your doctors there and say something. So I went to my doctors there. At first I got the same, you need to stick with what we're saying. You need to, you know, this is third world. It may be temporarily. You don't know what the chemicals they're using to make the RSO. You don't know what anything's going into it. You don't know what you're putting into your body. There's no real dosage, way to dosage. You know, pretty much in essence belittling any forthcoming effort that I had. Wasn't even willing to listen to me of how I was better. And my parents and my family and friends were coming in to my doctors and stating like, we can see the difference. Like, there's a significant change in this person. You know, and it started from the time within 4 or 5 days of him starting this. It started from that time. Well, there again, I've had a fight since the day of, because my tumor now is a grade 2. So I have a few of my doctors that know, and I've actually had one doctor that actually signs and fills out my paperwork and sends it into the state, so I don't have to pay for my card, because my insurance will pay for it, because he signs it and recommends that I do have a doctor that's willing to state on record that he will say this works for him. He said I won't do it for every case, but he said I will say this. He said I cannot be a doctor and not say that I've not seen this work on my patient. I won't. And so to this day, I take a gram of Simpson Oil per day. I usually do it in 90-day cycles, because the last time I did a full 90-day cycle, I had no symptoms for about 6 to 8 months. Started having some headaches and stuff again, went back in, did an MRI, noticed my tumor was starting to grow a little bit more again. First thing I want to do is obviously start me on chemo. Well, not my choice. So the lucky thing is that of me, they put me on oral cycles of chemo. So I just choose not to take them. And they believe that obviously for a long period of time, they believe that I was taking this, and that was what in turn was doing it for me. But then I made them call their bluff in essence and said, well, you do a full panel blood work on me every week. So you know every single thing that I pretty much eat, drink. I mean, they do a complete panel. It's pretty much like a DNA breakdown when you're that sick. Like, that's what they do. Well, I was like, why don't you test the levels of radiation then if I'm taking this chemo? If this is what's doing it, and test the levels of THC that's in my body, which at the time I had a friend, which I had met through Steve, that had able to give me some CBD enriched medication as opposed to more a THC balanced medication, which in turn has worked a lot better for me. So the Simpson Oil that I am able to get and help other people with that I take now is pretty much a CBD rich. There's pretty much about 6 to 8% when we test it THC that's actually in it. So I'm not really, in essence, I'm not really medicating to get anything but what I need for my body. It's not any sort of a THC, it's not any sort of a cerebral high. It's not even considered, for a drug test, it's not even considered marijuana if the THC is below a certain amount in that property. So if you're below a certain amount, it's, well, obviously you know too the way the laws are, there's a lot of stipulations they want to say now, like they just ruled that all of us are having a problem with is now concentrates are illegal.
Mm-hmm. Here in Michigan.
Right. So now we're back to, I'm operating on a legal scale with my card and my caregivers and what I'm able to do, but now I'm operating on a legal scale, then I'm going back to having to get my medication in essence on a legal way, because if I stop taking it, then I'm going to be back to the medications which are in turn tearing my body up, and it's not helping anyone. So, you know, it does work for, I'm not saying it works for everyone, because I can't say that, because not everyone's willing to try it, unfortunately. It's very conservative, but all I can say is I can contest from what it's done for me, what it's come from. I've had 2 points in my life since I was diagnosed where I've gotten better, where my motor skills are to the point now, and had a seizure over 2 years ago where I was in the hospital in a coma for 6 months. I had to learn how to walk, talk, go to the bathroom, eat.
My God, the lawmakers are putting you right back into that same kind of danger.
It's a repetitive. It's not about the person most of the time. It's about the society. It's about the scope of what insurance companies, and about liability being sued, and about being afraid to say I can see this medication's working for this guy. Just because it doesn't work for everyone else, and I didn't prescribe it to you, he was able to be smart enough to come out on his own and use his own medication and use his own ways. It's a very hard thing. It's a hard message for us to go out to tell people. I try to share my story with everybody when I'm out with some other people that we go around, you know, and provide medication and medibles to people. And there again, now that everything's illegal, where do I take it to be tested? Because all my patients that I caregive for are all chronic patients. Cancer, AIDS. I mean, my father just passed away last year of esophageal cancer. I was his caregiver. I saw him wither away to nothing in 4 months. And only thing they wanted to do is put him on morphine drip and made him pretty much an alien. And he said the same thing, I don't want this. And so I was doing the same thing. I was giving him medication, which is now illegal, to make him not suffer as much. And he was a better person for that time. He was in less pain. He knew what was going on instead of being a zombie sitting in a chair with his eyes sunken in. Yeah, he didn't feel any pain, but there was nothing.
No quality of life.
Yeah, you know, and in essence, maybe it wasn't the best quality of life, but at least he knew. He had memories at the end. He wasn't no one. It wasn't a hollow shell. And so by seeing that, and then my fight with it, losing a couple of friends this last year that had multiple year fights with it, and seeing the injustice that I've had some friends that are very sick that I have caregived for, that have had kids and had bad situations because their significant others called the cops on them because they knew they were using medical marijuana, cannabis, or RSO for seizures or whatever it may be. And so, you know, they use the law against them. And so it's hard for me, I guess, is what do I do now? Where are we at?
Thank you.
You're welcome.
I appreciate it.
Yep. You can beat cancer. You can beat illnesses.